we are on the concluding leg on public health delivery system, which we have been engaging on in the last 3 episodes. There have been enormous efforts of privatization, liberalization, and cuts in the funding of health and social services. These efforts are driven by an ideology of free trade, backed by promises that markets can do better than states because they are supposed to be more efficient and less bureaucratic. These positions have worsened the quality of health services. Trade unions say the private-public partnership, like many, is a conduit pipe for a diversion of much-needed public resources to private ends. PPPs have received bad press in recent times, with several reports showing that private-public partnerships in healthcare are failing. All over the world, healthcare workers are fighting against the privatization of public hospitals. According to them, it is a fight for social justice and equity, among other reasons. So on your program policy on track today, we shall be interrogating the issues, challenges, or risk of private-public partnership in healthcare. The Public Service International, PSI, which represents 8 million healthcare workers, believe that care must be available to people who need it, not just to those who can pay. My name is Mo Wilkie, your host, and you are welcome. Let's bring you first stories making rounds in the world of work in the last 1 week.
Turnout for a 16th round of Yellow Vest protests in France on Saturday has reduced and the march is largely peaceful. Relieved President Emmanuel Macron had struggled to find a response to the movement. President Macron in January released 10 billion euros to boost government support for low-income workers and started a series on marathon debates with local representatives. The leaderless movement started as a protest against high fuel prices but turned into a broad anti-government protest. UK manufacturers are cutting jobs at the fastest pace for 6 years, with confidence in the sector hit by Brexit uncertainty. According to a survey, the UK manufacturing sector continues to suffer the slings and arrows of outrageous fortune as the harsh realities of Brexit uncertainty, challenges in the global economy, and a weak pound affected confidence, jobs, and overall anxiety. The sector's sickness was also visible in employment levels, with the steepest job losses in 6 years and with business optimism at its lowest levels since 2012. A number of business groups have warned that the uncertainty surrounding the terms of the UK's exit from the EU is damaging business. The head of Brazil's Vale mining giant has stepped down following the collapse of a dam which killed 186 people in the town of Brumadinho. At least 122 people are still missing more than a month after the accident at the dam, which collected waste from an iron ore mine. There have been conflicting reports of the safety of the dam, which is the world's biggest producer of iron ore. The cause of the collapse is still to be ascertained, but experts believe liquefaction was to blame. Liquefaction is a process whereby a solid material such as sand loses strength and behaves more like a liquid.
Trade unions are saying that healthcare is a human right and should not be for sale. Efforts to reformulate health as a commodity has led to atomization of healthcare delivery and outsourcing and privatization of central as well as peripheral components of the health service systems. Even the International Monetary Fund (IMF) says that the benefit of privatization is usually only an illusion, stating that it has left the United Kingdom in a poor fiscal position. The IMF says there is not a good business case for public-private partnerships as they create hidden liabilities for governments. The Public Service International (PSI), an umbrella body for 8 million health workers, say public-private partnership is to be avoided because they are risky and costly. PSI wants PPPs avoided, especially in low-income, low-capacity contexts where they can constitute a threat to the entire health system.
The Public Service International (PSI) notes that the main reason why health for all remains a mirage is because health is perceived as a commodity by business interests whose profit-driven ideology has been swallowed hook, line, and sinker by governments across the world. Healthcare is the most important issue of concern to Americans today. In a poll conducted by the CNN during the midterm elections, 41% of respondents voted for healthcare as the most important issue facing the country. Immigration, economy, and gun policy received 23%, 21%, and 11% of the poll, respectively. The U.S. health system is the most expensive in the world. It is probably the most inefficient among the high-income countries. Despite the vast amount of money sunk into the system in the U.S., almost 30 million people are not covered by health insurance, leaving them vulnerable to catastrophic health expenditure. These include 4 million people who have lost their health coverage since President Trump was elected.
In the United States is one of the few developed countries in the world where health care is not a public right. Even in the UK and the United Kingdom, conservative people, right-wing people who like to privatize everything, they support national health, even though it's very expensive, because they believe that, like all other individual rights, you have the right to health care. But they don't have that. That's never sunk into the American psyche. In Nigeria, it's getting to the point where it's very similar. In Nigeria, you spend less as a percentage of national income on education and on public health than any other country in West Africa. The amount of money that's spent in Nigeria on public health and education is pathetic. It's shocking. It's less than 6%. It violates all kinds of UN resolutions and UN ideas on how to keep a prosperous, healthy, working population that can stimulate the economy. And unless more and more people know about this and do something about it at the ballot box and in the streets and in their communities, it's going to follow the US, where when people get sick, they have nowhere to go. They just hope it goes away.
Global perspective of privatization shows that it has almost always failed, not only in African countries, but even in well-developed countries where PPPs have been introduced.
And the public sector, it's where you would find majority of your lower classes or of those that may not be on medical aids, making use of the public sector facilities, with private sector being privately owned and being utilized by the haves. And that's where the difference is. But having now seen and observed how the facilities in private sectors versus the ones in private are being not the same, there is now more talk on having to establish the National Health Insurance, which is at the advanced stage of it now being adopted, and at some point it be the facility for all that will then cater for all the classes, irrespective of which level you are. And that would be at least cheaper and affordable, instead of one making use of a medical aid for the better treatment. So the NHI seeks to address that very problem. But when it comes to the burden at the public hospitals, you would find that majority are using the system because most are unemployed, people have no medical aid, so they have nowhere to go except the public sector, and they then get overburdened. And of course, migrants or foreigners would definitely make use of the public sector facilities. So that's why the larger number of the population, jointly foreigners and your own South Africans jointly, would then mean a bigger bulk would fall into the public sector. Hence, it may not be able to carry the weight given the big numbers that would be there. And the private sector would always cater, of course, having said, those who have medical aids, those who have monies, and it would serve fewer as compared to the public sector. In South Africa is that we're not opting for privatizing. Instead, we're saying national health insurance, which would then mean even those who are in private should compensate into the national health insurance. They should not be seen them benefiting only and at the expense of the poor.
Public Service International General Secretary Rosa Pavanelli believes that care must be available to people who need it and not just to those who can pay.
We have been witnessing 30 years, 40 years, since the era of Margaret Thatcher, of these massive way and claims of privatization of public services. I know Nigeria has been resisting in many sectors, although the attempt to privatize has been really hard in some areas. Just to think of the Lagos water privatization. And mainly after the financial crisis, it has been a mantra of the financial institution, monetary fund, regional development bank, all the financial governance saying you have to privatize services, you have to privatize school, health, pensions, whatever, and use public-private partnership to provide services. It will reduce the cost on the public budget. It will enhance quality and provide a better service. Now there's plenty of evidence that's not true, that PPPs are a complete failure, and that PPPs are not only dangerous because they are a tool to privatize services, reduce workers' conditions. But the most interesting thing is that inequality has grown even further in the 10 countries, most of them in Latin America, that have not reconsidered their policy of privatization. So what we are talking about here in Nigeria, the path is clear. We don't have to privatize.
PSI argues that there is enough wealth in the economies to enable the required public investment if corporations and the very wealthy pay their fair share.
The health situation in Nigeria is similar to that in many other countries, where insufficient funds is allocated to healthcare delivery system and people suffer as a consequence. Corrupt practices by management in pursuit of public-private partnerships have marred service delivery. A good example is the Federal Medical Center Owerri FMC. Trade unions in the health sector uncovered the action taken by highly placed officials in the Federal Ministry of Health to cover up the series of malfeasance. The unions say over 75% of the healthcare systems are in private hands, yet evidence abounds that PPPs are expensive, risky, and opaque.
One of the chief ingredients of dysfunction in the health system, okay, is the new norm where the managers of the health system have decided again to deceive Nigerians as a way of covering up their inept ways of administering the system. They have told Nigerians that the only way for the Nigerian health system to move on is privatization. And because they want to achieve that goal of privatizing the health institutions, the federal health institutions and all other health institutions, and go behind to buy them cheaply to themselves. Just like the NEPA people, the NEPA managers lied to Nigerians that once they privatize NEPA, we'll have more lights, we'll have cheaper lights. I don't know if you have cheaper lights. I've not seen it anywhere. I've not seen more lights anywhere. And these lights, NEPA just was shared by managers of the NEPA system without capacity. The same way they want to introduce into the health system. Today, I want to tell you that why I say it is not the true perspective or true face of what they are saying, that it is privatization that is the answer. In Nigeria today, over 2/3 of health institutions in Nigeria are private. That is not my own summation. That is a research carried out by medical doctors themselves. And it is true that over 75% of health facilities in Nigeria are private. So, if these private health facilities that are overwhelmingly spread out in all over the country have not given to us all these years improved health services, has not given to us all these years improved health indices, have not given to us all these years cheaper health services, is it when they come and then, with their Shylock minds, when they come and own the existing public health institutions, which are the only hope of the poor and downtrodden? These are the only areas where you can have some cheap level of health care. Is it there that they want to take over and then make the health system to be improved? Would they be affordable? As a developing nation, the country, the government cannot just leave health service in the hands of the private people alone. Cannot. Because that will be suicidal.
The idea of privatization of the public health sector, how will this impact on your members?
I make bold to disabuse the mind of Nigerians that what we have on ground as public health facilities is enough. And all over the world, except a government that wants to shift the public responsibility to other people, the major duty of providing accessible, affordable, quality, safe, and equitable health care services for the masses, the bulk lies at the public sector. And it is a function of the government We have seen what privatization has brought in other parts of the globe. The best performing health sectors in Nigeria are those of United Kingdom, Canada, United States of America, and some other countries like China today. They did not venture into shifting their responsibility. Nigeria is fond of one fact. All workers in Nigeria subscribe to contributory pension scheme because the government failed in its responsibility. And we are yet to eat the ground and deliver the best. In this country, we were thinking that power supply is not functioning well under the public provision. We went private, and the situation has been going from bad to worse. Privatization of health sector is an evil wind that will blow nobody any good.
What is the state of infrastructure in our country?
Most times, structures that are claimed to have been built over the years never exist. The high level of corruption makes it customary for the managers of the health system to just put up bogus projects and say, in the books, ABC has been built, paid for, but it doesn't exist. For instance, like even in the case of FMC Owerri, where a block, a particular facility structure was claimed to have been completed, certified completed, payment done. And when we blew the whistle and when we got to the place, the said site was still very fallow. Even the grasses have not been cleared. Yet, that project has been paid for. It was when we blew the whistle and the investigation started going, then the Federal Ministry of Health, in a bid to cover up, deliberately returned the same person that has embezzled that or diverted that money, and then protected the person, and then made sure that they pump money in so that the structure will be built. In our own way, in order to say that we cannot be made liars, as from stage to stage, we also decide to just keep snapping as they are building. And they are dated pictures. And all they're trying to do, I want to tell you, Nigerians should hear this. They have decided that it is only by so doing that they can weaken GESU, so that they can open the doors to privatization, so they can buy these facilities and share these facilities amongst themselves at giveaway prices, as they did with the trauma center in Gwagwalada. They attempted to sell and buy that to themselves, sell it cheaply, and GESU reacted. Then the National Assembly also got interested, because, it's the House of Reps that runs the affairs, the legislative affairs of the FCT. So they got interested in the matter, and then they investigated, and they also came up with to see reasons with us. And it was at the point when it was to be sold that the House of Reps used a resolution to stop the sale. So that is the kind of crime GESU members are committing, because we want to preserve the public health institutions so that they can be cheap enough, they can be affordable to the common Nigerians.
It might not be realistic to wish away some level of private sector involvement in healthcare delivery, but such involvement must consider health as a fundamental right of all persons. Thank you for being part of this show. For your contributions and comments, please visit any of our social media platforms showing on your screen. I am Mo Wilkie. Bye-bye.